I'm John F. Kerrigan. I go by Jack. I'm the medical director of the pediatric epilepsy program at the Barrow Neurological Institute at Phoenix Children's Hospital, which is in Phoenix, Arizona. You know, I was the moderator or the facilitator for yesterday morning's session, and there were 8 speakers, and there were 8 really excellent speakers. The theme perhaps for the first half of the morning session was basic neurobiology of hypothalamic hamartoma. One of our speakers, Dr. Saper from Harvard Medical School, rolled out a hypothesis that the hypothalamic hamartoma may relate to a nucleus within the human brain called the lateral tuberal nucleus. And he doesn't have any direct scientific evidence at this moment to support that, but it's a hypothesis or an idea based upon his 30 years of experience of working with the hypothalamus. And so that, for us, that's a very important moment because it gives us a testable hypothesis. So basically, that's the kind of idea that can then lead the doctors who are working with the imaging and with the tissue to really go after that as an idea, either proving that it is true or that it's not. You know, the long-term significance or the big picture, of course, is helping patients that have this condition. So the theme of our international conference this year, which is the 4th international conference, is focused on the comorbid clinical problems that patients have or comorbidities. And that's kind of a fancy way of saying a symptom that's a fellow traveler. So the hallmark symptoms for hypothalamic hamartoma come in 2 flavors. One is that you can have central precocious puberty or early puberty. That can happen quite often in some of these kids as early as 2 or 3 years of age. And then the other flavor, the other type of problem that patients have is related to epilepsy. And they start off life with what are called gelastic seizures or laughing seizures. But as they get older, typically between the ages of 4 and 10, although there's a lot of variability to this with different patients, additional problems develop. And those are the comorbidities. So the most important issues would be cognitive. There's an impact on how well the brain works in terms of its thinking functions. So that would be using language, remembering things, learning things, controlling your emotions. And then the other major symptom that HH patients get is behavioral problems with psychiatric symptoms. And again, there's a lot of diversity to that. But the most common thing would be a rage behavior or a difficulty kind of controlling your emotions if you're frustrated about something that kind of makes you blow up. And all of those things, of course, have a major impact on how the patient is doing in life and quality of life, which of course in turn has a major impact on the family. The international conferences are really critically important. This is the 4th one and the 3rd one that we've had over the past, I think, 6 or 7 years. And what it does is it brings together the community of HH patients and families, the providers, the doctors and nurses that are taking care of the patients, and then also the researchers. So there would be 2 things that really come out of this conference. One would be an educational piece. So the many fine people who are, experienced and knowledgeable with HH can share that with, the younger people, shall we say. And then the other part is a collaborative part. That's the research piece. So that putting two people in the same room can really give rise to new ideas and new thoughts about an area of research. So one individual may have a great idea, but not the research tool, and the person that they're sitting next to may have exactly that tool, and they're open to looking into a new area of investigation. So that's where things actually get done and we make progress.